Humerus. This right here is going to be the head of the humerus. We've already talked about heads before. The heads are round. So here's the head of the humerus. If you notice that there's a little bit of an angle right here, a little bit of a curvature, okay? That little line right there is known as the anatomical head. You need to make sure you specify what bone you're actually describing the head for, because we have other heads. This is the head of the femur. This is the head of the humerus. This is the head of the radius. Okay, so you have to specify that this is the head of the humerus, and you have to say that this line right here is going to be the anatomical neck of the humerus. So everybody understand that? So there's the anatomical neck. Next, we have this groove right here. This groove right here is known as the intertubercular groove. It's known as the intertubercular groove. And the reason it's called the intertubercular groove is because these two bumps right here are called tubercles. So the two bumps are called tubercles. The tubercle that's on the same side as the head, you're going to notice that the head is on one side more than the other. So it's on this side. This tubercle that's on the same side of the head is known as the lesser tubercle, and the one on the opposite side is known as the greater tubercle. So obviously, between the lesser and the greater tubercles is known as the intertubercular groove. So intertubercular groove. We called this, remember, the anatomical neck, right? Right here is known as the surgical neck. It's an imaginary line, okay? So here's the surgical neck, here is the anatomical neck. If we take the intertubercular groove and move it straight down, you'll notice that there's a bump. It is a subtle bump, okay? So it's not that pronounced. This right here is that bump, okay? The name of that bump is called the deltoid tuberosity. It's known as the deltoid tuberosity. The deltoid tuberosity is there, and most of these bumps are there for attachment sites for muscles. So this right here is my deltoid muscle. My deltoid muscle attaches onto my deltoid tuberosity. So everybody understand that? So again, all these bumps are attachment points for muscles. As we move a bit inferior, these two structures, here and here, are condyles. So this is one condyle, this is another condyle. They're collectively called condyles, okay? But they have individual names. This smaller condyle is going to be known as the capitulum. This larger condyle is known as the trochlea. So we have capitulum and we have trochlea, okay? Now, the trochlea is on the same side as the head. So one of the things that happens during when people ask me questions about this, as you guys ask me questions, is I will look for landmarks, things that help me identify where exactly I am. So what happens is people say to me, okay, what's this right here? I will look for the head, okay? Because it gives me orientation, because I know this is the head, same size as the head is the lesser tubercle, therefore opposite side is greater tubercle. Therefore, the same side, the condyle on the same side, is known as the trochlea. Therefore, the one on the opposite side is known as the what? Capitulum. So like I said, these are condyles here, right? What is the prefix we use for above? Epi. So these are condyles. These two bumps are known as epicondyles. The one that's on the medial side is called the medial epicondyle. So the head is on the medial side. This is the medial epicondyle, and this is the lateral epicondyle. So it sits like this in my arm. The head has to face medially. It has to, because that's what allows it to move like this. It's smooth to allow you to shift back and forth. If it was the other way, it would be very rough, and you wouldn't be able to move your arm very efficiently. Okay? So this right here is going to be the head, and it fits right in like that. So this is going to be medial. That's how you know this is the medial epicondyle. Therefore, if this is medial epicondyle, this is the what? Lateral epicondyle. Okay? Now, hit stop.